schools or say for mental health support, the end result of that is people do nothing, right? People feel really unmoored and incapable of helping. So there was a great piece of work led by an autistic people's organization in Edinburgh called Amaze, which is about autistic adults seeking mental health treatment and support. And the title of the report was Too Complicated to Treat, which was a direct quote from someone who said, well, I told my psychiatrist, you know, I have this and that, depression, anxiety, whatever, and also I'm autistic, and the psychiatrist is literally, well, I haven't done the training, or we haven't got any evidence-based approaches, so therefore you're going to get nothing, right? So I suppose I just wanted to say, that I think teachers should feel a degree of freedom and a degree of self-efficacy to do things that don't have an evidence base if they are not harmful and if they're done with the child and their family, right? So I think simultaneously we're saying we need better evidence base, especially for kind of whole school approaches, policy changes, major investments of funding. This is really important. But you can give a kid a wobble cushion to sit on so they can wobble while they're working. You're not going to do any harm. If they tell you that this is something that would help them, you can just do it, right? So I suppose I want to get the balance right between empowering teachers to take action to support the kids who's right there in front of them struggling, while completely agreeing with Jess that we absolutely have to be critical about things that claim to be evidence-based, and we have to drive a higher quality evidence base for our educators and for our young people.
Oh, absolutely. I'd agree with you on that. I did meant to say in my introductory notes when I said I'm not an expert, one thing I also meant to say was I come from an advocacy-based organization, so we are in favor of setting things on fire on a regular basis. But I would also say, you know, and genuinely, you know, when I go out and I talk to schools, we talked about 100 schools a year, one of the things I say, and I mean this genuinely, I'd love to be a teacher. I think teachers are wonderful. But they don't get enough support, they don't get enough training. So I hope they continue to do a great job with what they have. Unfortunately, we only got about 15 minutes left. Time is absolutely flying by. So we need to move on to secondary school. I don't, maybe Sue, Jess might be a little bit not disadvantaged in this, not in this conversation, but just bringing up the idea of secondary school, you know, looking at Ireland, looking at the UK. In Ireland and the UK, we have what's called terminal exams. You study for 5-6 years, and in 2 weeks, they evaluate everything you know over those 5-6 years, and not saying determines the rest of your life. Probably not the best way to do things that are for children that are ND. Any thoughts?
I go for it. I know just something that's very topical in our house at the moment, you know, for children who can't actually attend school, we don't have an alternative. We, you know, in terms of the exam system, our leaving certificate has a couple of practical elements, and the children have, like, those booklets cannot leave the school, for example. Yes, if that child were in hospital, the booklet would leave the school, you know. So there's a lot that has to be really like, I think there's a kind of a sense somewhere that we're all trying to pull a fast one and that we're being lazy, or we're being, you know, and once you start to trust that that person is actually doing their best where they're at right now, that they're giving you their best, it's a game changer, you know. So that would be my big, I suppose, coming from where we are at the moment with one of my kids you know, doing the leaving cert next week and what have you, you know, we don't know if, you know, she's going to be able to get in there or not, you know, and there's nothing to allow for that. You know, the school have been tremendous. I have to say that, like, they're, like, in terms of reaching out and trying to help us in. It's not like, I'm not saying this is a problem in any, you know, one individual or school or whatever, but it's just the overall systemic thing, really, that's the problem.
Yeah, sorry, Ken.
No, go ahead.
I worked as a post-primary teacher for quite a number of years before I changed over to primary, and like, really it is a very flawed system. And in with regard to neurodivergent learners, I mean, really the terminal exams by and large are a test of memory or retention skills. And if you look at neurodivergent learners, they are more likely to have fine motor difficulties. And that's just something you would see kind of on the ground, you know, across different neurodivergence. So like hands are falling off. You're doing these exams at a particularly difficult time of year from a sensory point of view. It's at the end of a school year, you know, terminal exams. There's probably some level of tiredness, if not exhaustion. There is the anxiety, there is, you know, it's just really, really hard. You're often asked to sit your exams in your school uniform, so that there's so many sensory pressures. The sun just seems to break through the clouds once the exams come on. It's really, really hard. And like, what I've learned, and I've learned this the hard way, is that there's more than one avenue into third level education, if that's where you want to go. It's not the straightforward route, or the Moduruk, as we say here, but there are other avenues. And I think we need to work on creating more avenues into third level training or education. And also Sue's been talking about universal design and universal design for learning. That can really be applied to assessment, and it boggles the mind why it's not being applied more, you know. And just let's try and get everybody to show their best and put their best foot forward.
Okay, excellent. Maybe just go to Jess next, because I say, Jess, you have about, from what you're saying, I'm guessing 5 to 10 years before they hit high school.
Yeah, so
what are we changing?
Well, so one thing that the pandemic brought about that has been a positive shift in expectations around assessments in the US is many universities around are not requiring SATs or ACT scores anymore. So back when I was in the classroom, in a high school classroom in 2010-ish, I think, you started to see some schools put on their websites, you don't have to do the SATs if you don't want to. There's other things you can do instead, but it was pretty rare. So my students were always looking for schools, like, where can I apply that doesn't require this? And now it's not common to have the SAT and the ACT be a requirement. So for me, what that has highlighted is we can do things that the disabled community has been saying we should do. And I think the pandemic highlighted a lot of that in terms of remote work, and you see a lot of companies resorting back to the way things were before and limiting access to that, and insurance companies with telehealth appointments getting restricted. But all of that showed us that it can work. And so I think the more that we continue to push on the systems from the inside of them and the outside of them, with evidence that these things are functional and happening and can continue to happen, and your quality of student has not dipped because you are no longer requiring the SATs and ACTs, I think that's what we need to continue to do, is empower people to have the data and the evidence to say, no, this is okay. And then also encouraging students to understand what their identities mean to them, so that they can also be pushing on those systems to do the same kind of work.
Okay, well, thanks for that. And maybe just again, just for Sue, just in what Jess was saying there, looking at different type of systems. So do we have an alternative in the secondary education system to terminal exams? And is there an evidence base for it?
This is something where I wish I knew more actually about different models of inclusion around the globe. So, I'm really only familiar with the kind of 4 UK nations which have, relatively differentiated education systems, but lots of ways are quite universal. And one thing I think is quite interesting about exams, so all of them have quite a lot of weight on exams of various different kinds. One of the details I think is really interesting is that even though in law, in both Scotland and I think in England and Wales, not sure about Northern Ireland, it's very much in law that you should be able to get support in school without needing a diagnosis first, right? In practice, it doesn't often happen that way, but it is your legal right to support. But I really found out recently from a colleague that an exam board who is setting, you know, the exams that their school uses does require a confirmation of diagnosis for a student to have additional support for those exams. So there's a conflict there between the legal rights of young people in terms of access to support during the regular school day and across the school year, and then what exam boards are, I have no idea why, allowed to require a diagnosis in order for someone to get extra time in their A-levels or GCSEs or higher, and perhaps also for terminal exams in Ireland. So that is catastrophic and ridiculous. And lots of schools are interpreting that as, well, because you won't be able to get support in the exams, we oughtn't to give you support the rest of the time because you need to learn how to do it properly, right? So I think it's a big problem. The other thing I just wanted to say was about the concept of cheating, right? So I think this is really interesting, is how additional support gets labelled as cheating or unfair. One of the things that we try and address in Leans is revising children's understanding of what fairness is, so that fairness isn't always about getting the same, you know, like chopping up a cake into equal sized slices. It's more about getting what you need. So even with a cake, if someone in your group was starving, you'd give them a bigger slice of cake, right? So I think the other thing that's happening, I completely agree with Jess about the impact of the pandemic. The other thing that's happening is AI, right? Things like Chat GPT are having a really interesting effect on education, particularly when you have to submit essays, whether that's school coursework or at university. And as a result, you know, educators at my university are having really serious conversations about, what is your education for? Is it, if you want to learn something, don't use Chat GPT to write your essay, because you miss the opportunity for learning and for feedback. And I'm here to help you learn. So there's really an appeal to the learner to say, engage with this authentically. And I think that's where we need to be having a conversation at secondary school level as well with teenagers, is about authentic engagement with learning. And that needs to be therefore meeting them with an assessment process that we can defend as representing an authentic way of capturing what their skills are, so that they can sell those skills to their employer or to their college or university later. And that's not about misrepresenting yourself or anything. That's about saying, here's what I'm good at. If you're interested in the things that I'm good at, then I could come and work with you, or I could come and learn more with you. So that's what our education system should be allowing young people to demonstrate, not I can get this grade on this particular hot, nasty day in my scratchy uniform from rote memorizing all the dates in Henry VIII's timeline, right?
Okay. Well, thanks, Dan. Actually, time is really pushing up against us, so we're going to have to wrap up in the next 5 minutes. So doing that, maybe I could just go back to each of the panelists here. And just one of the questions that I did sort of send out in advance was, what would you like to see in the next 20 years? And if you had one magic bullet, or one wish, one magic bullet, what would it be? If you maybe just give us a minute on that, would be great. And that'll bring us close to the time we did plan to finish at. If I could go just in the order we did the very first one, I could go to Elaine first on that.
Yeah, representation would be the bottom line for me. I mean, schools up and down the country opening autism classes, opening, special schools, whatever it is, and no consultation with somebody who is actually autistic. And there's quite a solid group of Irish autistic teachers out there. So really, we do need to have that kind of representation. So we should be there. We should be on the boards of management. We should, and there's no excuse, because every community has, a neurodivergent element of their population. So yeah, that would be a huge big thing for me. I think it's attitudes and judgments are the two areas that we most need to tackle, and they cost nothing. I think on the ground here in Clonakilty, it was one of the things that kind of emerged from the Autism Friendly Initiative, was just how people genuinely wanted to know what to do to help. You know, you're talking about pushing open doors a lot of the time. And just that, like starting a conversation at a local level or whatever it is, I think it helps to kind of address this whole thing of, oh, that's something we should be frightened of, and that's something we've got to stop, you know. So
Okay.
yeah, those would be my key points.
Oh, thank you very much. So come over to you, Jess, next. So what would you like to see in the next 20 years, and what's your one wish or magic bullet?
So I think that what I'd like to see over the next 20 years is an increased push and focus on dismantling individuals' internalized ableism. And I think beginning to work on recognizing your biases related to disability and what you've been consuming within your culture that has provided this groundwork for this internalized ableism, because even disabled people have internalized ableism. I am no stranger to that. I do things all the time where I'm like, oh, that probably wasn't good. So I think over the next 20 years, more resources, more talking about internalized ableism and trying to really break that down. One, I don't know that I would call this a magic bullet or anything of that nature, but one way I think we could do this is every university and corporation that exists that has a DEI office, diversity, equity, inclusion, disability is an explicit component of the DEI offices, because if it is not, they are missing a key component of diversity and equity and inclusion.
Thank you very much for that. Claire, your turn.
Thanks, Ken. I think in the next 20 years, I'd like to see more examples of where children and young people really feel like they belong and that they can be authentically real in their education settings. And we're going to do that by continuing to work on challenging and dismantling stigma and prejudice. I think one way we can do that is by continuing to promote the neurodiversity paradigm and operationalizing it. Sue has done great work in that. She's added pillars to Nick Walker's pillars. And also Ari Neiman is another scholar who's done great work in showing us how we can operationalize the neurodiversity paradigm. I think other programs or other approaches like universal design for learning, well, I'd love to see more of that in the next 20 years, and more hybrid and flexible models of education and support. Going back to basics, and for educators' task of their learners, who are you? What do you need to flourish, and how do you learn best? I think teacher and educator training needs a significant overhaul. I think we need to have very high expectations of our teachers, but we also have to go in with very high support for them, and part of that is their professional development. I think you mentioned magic bullets, and I think realizing that there isn't a magic bullet, and when I think of magic bullet, I kind of think of the quick fix. There's no quick fix to this, and it takes all of us to come together and work really hard and work hard in a sustained way as that. And part of looking for magic bullets, I think, is often we look outwards at other models that seem to be working well and maybe try and graft them onto our context. We always have to keep in mind our context, otherwise, these fixes won't work. So relationships, collaboration, that continued desire for change and improvement, a desire to do better. And I think that's how we will get more neurodivergent people in the education system flourishing and thriving.
Thank you. I fully agree with you on that. And the last word for Sue.
I want to see more co-production. I want to see people working together, neurodiverse teams across kind of traditional boundaries. So neurodiverse pupils, parents, staff. And of course, that requires creating an environment around our education settings where neurodivergent people feel comfortable being out. So that's a kind of prerequisite for the type of co-production I'm talking about. So that's what I'd like to see in 20 years. I think that relates to all the recommendations the other panelists have made. It's part of the mechanism of how we make change. The magic bullet, I'm going to give you one that I think people could go away and do right away in their own education setting, which is so I was a disabled student I was supporting was once told by the Disability Support Service when they were asking for supports, the support service said, it's not a pick and mix, you know, right? It should be a pick and mix. It should be literally a pick and mix. So you should have a resource cupboard with stuff in it that people can just go and get. And that might be a digital resource cupboard. It might be about software, text-to-speech software, or, you know, things that highlight like a little window on your screen to look at and blur out everything else, these kinds of things. Or it might be a physical resource cupboard with bean bags and fidgets and ear defenders and all those sorts of gubbins in. But like, make a pick and mix for your neurodivergent learners to go and take what they need. And that, I think, would make a big difference and is relatively achievable to people.
Okay, well, thanks very much. And thanks to everybody on the panel today. I just want to say I only got through half the question. So if anybody wants to stay for another hour, we'd be good to do that. But we did make a promise to everybody that we would finish about 5:45. So we'll try and do that. So just want to say sincere thanks to everybody. It was an enlightening discussion. I hope you enjoyed it as much as I did. I know we went off track on things like that on a couple of occasions, but that's always good. We have pick and mix to take away as our little view and image for the day. Just to let you know, this was the first day of the conference. We have tomorrow's the 26th. So in the morning, it's professional development for mental health professionals. So we'll have autism and mental health with Connor Davidson and Hazel Griffiths coming up at 9:45. With Jess Eccles, neurodevelopment, neurodiversity and hypermobility. In the afternoon, it'll be ensuring equity in mental health services. So Alexis Quinn will be talking at 1:15 about a life worth living. We have a couple of breaks. Margot Wrigley, who's the clinical director for adult services with ADHD in Ireland, is a good supporter of our service. We'll be talking about adults in ADHD and the evolving response in Ireland. And now we have another panel discussion travel tomorrow. So there's lots of exciting things to come tomorrow. So if you were here today, we hope we see you again tomorrow. And thank you very much.